actually going to talk about the 4-day prenatal crash course, and for today's lesson, we're going to talk about newborn care. I know that today was the day that everybody was waiting for. We're going to talk about everything from diaper changes to when to call the doctor, how to feed, skin to skin, a whole bunch of things. So please tune in, watch the rest of the video, and I know this will help your family a lot. The first topic that we're going to talk about is skin to skin. Skin to skin is very important when your baby is transitioning, especially because after your baby delivers, there's a lot that is going on in terms of processing. Your baby's learning how to regulate the temperature, regulate the sugars, as well as breastfeed. And as you can see, when the baby is alone like this, there's not a lot of stimulation between mom and baby. So what we want to do is we actually want to unravel the clothes. A lot of people, they have the baby like this and the baby's all swaddled up and bundled and they're saying, yes, I'm skin to skin. I'm sorry, this is not skin to skin. What you want to do is actually unravel your baby. You want to actually take the clothes off as well. So you'll take off the shirt. A lot of these have like a button shirts. So you'll take off our shirt and leave just the diaper, because you definitely do not want to be pooped on or peed on by your baby. So we have our baby, we're going to be skin to skin with our baby. Usually hands up like this is good, and skin to skin means mommy, you're not wearing anything. So me, I have clothes on, I'm not going to take it off, I'm sorry. So you want to be skin to skin with your baby. So that's nothing in between, no blankets, no shirts in between, skin to skin. Skin to skin is great because it helps keep the baby's sugar regulated, it helps regulate the temperature, it helps bonding, it even helps mommy, believe it or not. So moms who do skin to skin, they say that they are more calm, their blood pressures are more regulated, and there's just so many benefits. It also helps for breastfeeding, because if the baby's skin to skin with you, as soon as they start bobbing the head, you just pop the baby right on there. It makes it a lot easier to do baby-led feeding. So thank you so much for the skin to skin. Next we're going to talk about diaper changes. So right now we're going to talk about diaper changes. So our baby, let's say, has a nasty poop. In the beginning, your baby's poops are called meconium. It's going to be black and tarry and really sticky. But it's important that you're checking your baby's diaper often, usually before every feeding, because if you're not, sometimes you don't smell it because meconium doesn't have a smell. But if you leave it on for too long, it can actually cause a lot of irritation. So what I'm going to do is I'm going to put a new diaper underneath my old one. This is key, especially for boys, because as soon as you lift up the diaper, they just go whoosh. I know, because I have 2 boys, so I go through it all the time. You want to have your wipes ready. If you have a baby that has a circumcision, you would also get your gauze and your Vaseline ready as well, just because you want to keep the diaper changes as short as possible. So I'm going to unwrap the flap. The flap is always on the top, okay? And then I will use the flap to actually wipe and clean off a lot. Then I will use my wipe and go front to back for girls. It's very, very important for boys that you actually clean underneath the testicles as well, just because sometimes they get some gunk up in there, and you want to make sure they're nice and clean. So you use your wipe. You can actually store the wipe in the old diaper. You take the diaper and roll it up. One flap goes here, one flap goes here, and then you take the diaper, you close it up. I usually like to close it just like this. Take the flap, the other flap right here, and then it's very important to make sure the umbilical cord is outside of the diaper. If the umbilical cord is inside, what happens is it can get filled with urine and can cause infection. For boys, make sure when you're closing the diaper that the penis is facing down, because if it faces up, it'll just shoot right back into the face. And actually, I didn't even know that with my first until like a month went by, and I kept asking myself why I kept going through clothes so often. So that's why it's very important. Make sure to check the diaper before you breastfeed or before you bottle feed as well. And then we have some tips right here. Next, we're going to talk about feeding, because that is very important too. Thank you so much for watching. So right now we're going to talk about breastfeeding. This is very important because exclusive breastfeeding, if you can, I know that sometimes we have maternal conditions or baby conditions that don't allow for exclusively breastfeeding, but if you can, it's very beneficial to you as well as your child. For one, breastfeeding exclusively is free. Everybody loves a little bit more money in their pocket. So breastfeeding is free. It is also wonderful to gut microflora inside the baby. What happens is breastfeeding helps to create kind of like a protective barrier in the GI system of babies. So it actually is kind of like an antibiotic, if you figure that way. And actually NICU babies that are breastfed, they're actually, what happens is mommy's milk, what happens is when the baby is on the breast, the baby's saliva actually integrates with mommy's body, and she starts producing antibodies to protect that baby. And actually it is found that milk of moms who have premature babies and moms who have fully term babies actually have different compositions of their milk. And even when the babies are sick, or mommy's sick, the milk changes as well. I noticed whenever my baby was sick, milk actually looked different. And that is because your milk is specially made for your child, which is something that a lot of people don't realize. Also, exclusive breastfeeding babies, they have less ear infections, and they just have less hospital visits, less duration of hospital stay. Moms who breastfeed, they have less breast cancer, they tend to have less postpartum depression. There's just so many wonderful things. So to help you, I'm gonna give you a few tips. Now, there's gonna be so much more tips that we can talk about. I'm just gonna talk about a few basic ones. One, you want to start breastfeeding as soon as possible. Definitely within the first hour of life. Earlier the better. If you can start breastfeeding, pop that baby on, it'll be wonderful. Two, you want to make sure you have a good position for your baby. Your baby should be skin to skin and tummy to tummy. Now there's different positions you can try, but the position that I'm going to show you is the cross cradle position. For this one, you want to have the baby tummy to tummy. The head, the shoulders, and the hips are all aligned. A lot of times I come in, moms are like this, and they're like, my baby's not latching on, what's going on? So what you want to do is you want to have the baby in a comfortable position, tucked in with your arms and everything. What you're going to do is take this hand, here you're going to support the back, you're going to support the head here with your fingers. So my fingers are actually ear level, and my hand is actually supporting the neck and part of the back. Over here we see that the legs are very nicely tucked in. What you're going to do is there's kind of a magic spot right here. You want to lift up. This is Rachel's magic spot. You lift up like an underwire bra right underneath your nipple. Then you take in a C position. There's different latch positions. Me personally, I do the C position. You take in a C. What you can do is push back, because your milk receptors are in the back of the breast. They're not in the nipple. So you push back, especially for colostrum. You push back and then you compress out. And that's how you're gonna get some colostrum. You put some colostrum on the tip of your nipple, and then you do nipple to nose, not nipple to mouth. So you do nipple to nose. When that baby goes up, that's when you actually put the baby on. So if your nipple to nose here, baby goes up, and then you can get a nice deep latch. That's very, very important, how you're latching that baby. You want to have the mouth over not only the nipple, but also the areola. That's the dark part of the breast. And then that will help you wonderful. It will work miracles for you. And then if the baby's on the areola, not just the nipple, what's going to happen is you're going to have a lot more effective milk transfer. That's the key here, effective milk transfer. Your baby can be breastfeeding for 1 hour. You go, oh yeah, my baby's breastfeeding, fantastic. But if it's not actively and effectively breastfeeding, your bilirubin will be high, you won't have really that good output from the baby from diaper changes. You might have some weight loss as well. So you want to have good effective milk transfer. When you are breastfeeding and let's say the baby latches off, a lot of times let's say you kind of get tired and then the baby latches off and it gets just on the nipple. What you do is you simply take a clean finger and you put it, and then you just detach the baby, break the seal, and then you latch the baby on again. It only takes a few sucks with an improper position to really, really mess your nipples up and cause nipple soreness. When you are done breastfeeding, you can put the baby back to the original position, burp the baby. It's not a massage. You're not massaging the baby, you're actually burping that baby, okay? So, and after that, you can keep going skin to skin. You don't have to put the baby to the bassinet back or your crib. You can keep doing skin to skin as much as possible. Skin to skin is not just the first hour. It really helps to do as much skin to skin as you can. So Thank you so much. Next, we're gonna talk about bottle feeding. So right now, we're just gonna talk about bottle feeding. Bottle feeding is very important to effectively know how to bottle feed your baby. Because if you don't, what can happen is sometimes they can choke on the bottle or you can overfeed your baby. So I'm just gonna talk about effective ways to feed your baby. Sometimes also, if you don't know how to bottle feed the baby, a lot of the times the newborns are very, very sleepy and they don't feed as effectively. So you think that they don't want to eat as much. You're only eating like 5 or 6 cc's of the formula or your breast milk, and they actually want more, but they don't know how to effectively suck and swallow. So what I do for my babies is I usually wrap them up. You want to make sure your baby is warm before you have feedings, because if your baby's cold, it can cause some disturbances in their GI system. So I make sure my baby is warm. You know, you can do skin to skin first. You can wrap the baby up. Wrapping just makes it also a little easier to position. What a lot of people that I find do is they take the bottle and then they put the baby in the cradle and they just go like this, and then they wonder why the baby's not eating. So what I usually do is you can have 2 ways. So I'm gonna sit here actually. So I can either sit down and I can feed the baby. What I do is I actually lift up the baby, and if I have like a little handkerchief or napkin here, you can lift up the chin. So you can't really see from this baby because he's just a mannequin. But you will lift up the chin. I do some chin support. You make sure the tongue is on the bottom of the bottle. Because what happens is a lot of babies, sometimes they like lift up their tongue. They don't really have the ability yet, and they haven't learned how to bring the tongue to the bottom. So what I do is I kind of tickle the bottom a little bit of the lip, wait for the baby to open up, and then I make sure that the baby is actually sucking appropriately. I do a little bit of chin support, I help, and then what you can do also if you are breastfeeding is something called pace feeding. Pace feeding basically is you'll feed a little bit, you'll stop, give the baby a breather, feed a little bit more. That helps to prevent the baby from being discouraged on the breast. Because what happens is when the baby's drinking a bottle, it's a lot easier. So then if baby's drinking a bottle, they're like, this is so easy. And then they try to get to the breast, and then they find that it's a lot harder. So what I do is you'll feed a little bit, you'll let them rest, you'll let them pause, regain, and then you'll feed more. That way they don't get so used to the bottle that they don't want to breastfeed. And I understand sometimes we do have to give some supplementation through the bottle, whether it be the bilirubin's high or mother's preference or physician's order. So don't be discouraged if you do end up having to bottle feed. Sometimes if you have to give supplementation, the best supplement to use is your own breast milk. So if you can use a pump, that's the best. But keep in mind that if you try pumping in the first few days, you're probably not going to get much out. But you can always try, you know, and what you can do is if you do have to give formula, you can make up the lost stimulation by pumping. Just don't be discouraged if not much milk comes out, but you do need to have some extra stimulation to increase and protect your milk supply. That is the theme, protect your milk supply. So this is me feeding my baby here with nice chin support. When we're done, we birth the baby. So I'm gonna put my bottle to the side here. What I do is I hold the baby firmly here, chin, and I'm supporting the chest here. And you can actually sit your baby on your lap, and you can actually burp like this straight here. If your baby starts choking for whatever reason, it's good to have a bulb syringe next to you, especially for newborns. So I actually have my bulb syringe here on my crib. So if my baby was choking, I would be patting the back, and then what I can do is first you push away from you, and then you put it in the corner of the mouth, you suction out, and then you can put it in a napkin or something like that. You can do the same thing in the corner of the mouth, put it in a napkin, something like that. If the baby's crying, at least that's a good thing. If your baby's not crying and your baby's blue, you definitely want to keep patting the back and notify the nurse as soon as possible if your baby does not start crying soon, especially. So this was our bottle feeding section, and I really hope that you enjoyed it and that it was helpful to you and your family. So right now we're going to talk about SIDS. For those of you who don't know what SIDS is, it's sudden infant death syndrome. This is very passionate to me because the safety of our baby should be top priority at all times. SIDS is important to know the risk factors that you can do to prevent SIDS. Now, the thing that's kind of scary about SIDS is that there's no real indicator why some babies die of SIDS and other babies don't. But what you can do to protect your healthy baby is by decreasing the risk factors that can contribute to sudden infant death syndrome. The biggest thing that you can do is have a safe sleep environment. This is a safe sleep environment. It is a crib. The baby is on a nice hard flat surface with no loose items besides a bulb syringe. You don't want to have any teddy bears, you don't want to have any crib borders, nothing like that. We have the ABCs of safe sleep. It's just easy to remember. A is alone. That means you don't want to sleep with your baby. If you fall asleep with your baby, it's important to put the baby back to the crib as soon as possible. If you're feeling drowsy, make sure that you have some family members next to you so that if you do fall asleep, they can wake you up, maybe possibly put the baby in the crib for you, or they can hold the baby for you if you're drowsy. But you want to make sure that the baby is sleeping alone and nothing inside the crib. So a lot of times I'll see those borders, I'll see those pillows, I'll see those big thick blankets, nothing. The other thing is the baby has to sleep on the back. Back is straight on the back like this, not on the tummy. All right, if the baby's on the tummy and starts spitting up, they actually are at risk for choking. So that's why it's very important. On the back, flat on the back on a nice hard surface. And then in a crib, of course, in a crib or bassinet. Another few things that are SIDS risk factors that a lot of people don't realize, one are fuzzy blankets. You don't want to have those big, thick fuzzy blankets because they cause the baby to overheat, and also it doesn't circulate oxygen very well. Same as those borders around the crib. Two is a big one, it's mittens. If your baby has a tendency to scratch the face, you can, if you want, use the pajamas that do not detach, but if they have mittens that detach, what happens with babies, as you know, they love to suck on their hand. They're sucking all day, they're going at it, and what happens is that mitten can actually detach from the hand and get lodged in the throat, and then that's how they can choke, and they are at risk for sudden infant death syndrome. Another big one that deals with sleep is you do not want to leave your baby sleeping in a car seat for a long period of time. If the baby's in the car and there's someone watching and you're keeping an eye, that's okay. But once you are out, you don't want to take that car seat, put that baby down, and let that baby sleep on the floor for a long period of time. So what happens is the baby is not at the right angle, and what happens is they can have car seat asphyxiation, where they're sleeping in the car seat and their head goes down like this and it blocks their airway. And so they can actually stop breathing in the car seat while the baby's in the safety of your house or wherever you might be. So that's why it's very important. And I just wanted to educate you so that you know how to protect your baby. So for today's video, we're going to talk about when to call your pediatrician. I know that there's a lot of things about newborns that people get very concerned about, and there's some things that babies do that are actually very normal that actually are not reasons to call your pediatrician. Some of those, when your baby's born, your baby will have a lot of amniotic fluid in the system. The first day or two, you'll be noticing the baby will be sneezing a lot. That's just the baby trying to get rid of that fluid. You might even notice the baby will be congested. As long as there's no fever and there's no heavy breathing, difficulty breathing, usually fine. It's just the congestion, especially as the baby's coming down the vaginal canal. What happens sometimes is all that friction and all of that intensity causes the inflammation to the nostrils. You do not want to use a bulb syringe in the nose unless there is fluid coming out of it. Now this is a big one. Some people are like, oh yeah, I've been taking it out and it's still there. Of course, because every time you're introducing something else into the nose, it's going to be inflamed more. So you just let it go naturally. You don't really have to do anything for it. The sneezing, same thing. As long as there's no other signs of the baby having difficulty breathing, you're okay. Babies sometimes, they have some weird noises as well that you might notice. If your baby starts having something called grunting, now that is definitely a reason to call your doctor. Grunting is when they're kind of like, it sounds kind of bad to hear, but that's the truth. Especially if your grunting is accompanied by something called retractions. Retractions are when you're looking over here and your baby's trying really difficult that you can actually see those accessory muscles at work. So it's very important if your baby's using accessory muscles, if your baby's grunting, you want to call your doctor, especially if you're noticing your baby's breathing fast. Babies actually naturally breathe fast. They might breathe between 30 to 60 times per minute, and that's fine. But if you start noticing that they're 60s and beyond, that's definitely a reason to call, especially if your baby changes color. Another thing to notice is how to take a temperature. So this is something every mom should know how to do. So for newborn babies, we always take something called an axillary temperature. That's when we actually put it underneath the arm. Now, the easiest way to do it is to make sure that there's no clothes blocking the arm. And you would want to try to clean this before and after each use. So what we do is we have our bare underarm here. We turn our machine on, and now here, this is the key. Most people, they put the thermometer like this, they close it, and they're wondering why it's cold. But as you can see, the little tip is coming out of there, and that's how I know it's not a real measurement. So what I do, instead of bringing it out like this, I actually put it inside the crook of the baby's armpit, just like this, and then I close it so that the whole thermometer is being covered by the baby's skin. That's how I know it's actually a better measurement, and it'll read a lot faster too. So I have the thermometer like this. If your baby has a temperature 100.5 or above, sometimes even 100.4, you want to call your pediatrician, especially if your baby is less than 2 months old. They might want to see you. If your baby's over 2 months old, sometimes fever can be accompanied by the vaccines that they've gotten. Sometimes it goes down with the Tylenol, but here's the key. For any baby under 2 years old, you want to verify how much Motrin or Tylenol to give to your child. You never want to give any medication without confirming the dosage with your doctor. And actually, one good thing you can do is when you go for your visits, because they'll see you like 2 days after you deliver, they'll see you 1 week. In your visit, you can ask, what is my dosage for my Motrin or Tylenol if I had to give to my baby? Because that might save you a phone call too. So that's how to take the temperature. Other things that you would call your doctor for is if your baby's vomiting a lot, especially if it's projectile vomiting, if they're vomiting a whole feeding, if they're not waking up for feeds, that's called lethargy. If they're lethargic, they're not waking up, you can't stimulate them, that's definitely a call, and they might even send you to the emergency room. Another big one that a lot of people don't think about is yellowing of the skin, and especially if the yellowing goes to the eyes, because that can be something called jaundice. Jaundice is when your bilirubin levels get too high, your skin can turn yellow. The danger with high jaundice levels, high bilirubin levels, is it can actually cause brain damage if it is not properly treated. So all of these are very good reasons to call, but of course there's other reasons too, but these were just the main ones. We have fever, vomiting, lethargy. Oh, another one too is umbilical cord. While we're here, we can talk about the umbilical cord care. Now, my baby doesn't have an umbilical cord, but if your umbilical cord was getting discharge, foul odor, you definitely want to call your doctor. You might have to cauterize it. It usually falls off about 2 to 3 weeks, sometimes less, sometimes more, but just keep it clean and dry. You don't have to use alcohol anymore. That's not really recommended by the Academy of Pediatrics, but if you do a bath or something like that, you want to make sure the cord is clean and dry. So thank you so much for watching my video. Thank you so much for watching my prenatal crash course. I feel like we've talked about so much. We talked about pregnancy, we've talked about labor and delivery, postpartum care, newborn care. It's just a wonderful series to be a part of, and I hope that it really was a blessing to your family. Now that you've taken my course, I really would encourage you to schedule an appointment with me if you have any questions, and of course, just if you want to wrap up anything that we talked about, I would be more than happy to work with you and your family, because I'm here to serve you. So on my website, mommydidyouknow.com, there is a sign-up form next to schedule your visit. You can also call me. My number is on the description, and you can also email me at mommydidyouknow@gmail.com. I'm more than happy to work with you on your consults. I do virtual as well as in-house. If you're in the Palm Beach area or around me, I would work with you. And I do consults for actually pretty cheap, and I can work with you as well, because my main goal is to make sure that you and your baby are well taken care of. And thank you so much for watching. I really hope this was such a blessing.